So, I'd like to invite Katie McAllister up to here. She's going to introduce the next session. Katie's our operations manager. And as I mentioned earlier, we've got an extension in funding and we need to do a business plan. And today's our opportunity to co-produce that business plan together and talk about how we want to progress together on the extended 18 months and the time between now and then. Katie.
Hello. Can everyone hear me? Okay. Good morning, everyone. For those of you who I haven't had a chance to meet, as Mark said, I'm Katie. I'm been working with the ARC since January, 1 or 2 days a week. And my role really is, I'm based at the University of Liverpool, and my role is to sort of strengthen our processes and systems. Oh God, I didn't think I would be nervous, but I am, so forgive me.
Just get some names wrong and you can join the club.
Thanks, John. Joke. Okay, so my role is sort of threefold, really. So I've got 3 key areas of focus. The first is around our processes, sort of how we sort of monitor our progress. The second is working really closely with Jane on impact, so how we evidence and demonstrate and communicate our impact. And the third, which is kind of what this session is about today, is about our stakeholder engagement, so our member engagement, our public advisor engagement, and also engagement with other individuals or organisations who are ARC stakeholders. So the structure of this session kind of came out of feedback that we received from the last ARCFEST that more interactive activities would be welcome, or at least trialling them would be welcome. So it's a bit of an experiment. So we're just going to do some group work, basically. And it builds on something that we did in March, for those of you who were at the last ARCFEST, where we asked for kind of feedback to be placed on post-its in the lunch break. So we thought if we did that in a little more sort of structured, group interactive way, we might get more interesting outputs from it. So that's just a sort of to say really that we hope this session will be interactive, that you'll speak to each other a lot. We've got quite a lot to get through, so we're a little bit over time as well, so we'll try not to eat into lunch. We'll just cut down, say 5 minutes from each of the activities, if that's okay with the facilitators, so you can all get your lunch on time.
Might be 10.
Yeah?
Might be 10, but yeah.
Yeah, well, we can, if you like, there's an icebreaker session, which Pete's already said he doesn't want to do, and I can understand if people don't want to do that, so we can cut that down. We can cut that out if you like, if you know each other already. Okay, so just in case anybody isn't already aware, I'm sure Mark's already given the background and many people will know already, but the ARC as it currently stands will run until, I always get this wrong, September 2024. But we, along with all other ARCs across the country, have been given the opportunity to submit a business plan for an 18-month extension, which would take us to March 2026. So that's really, really good news. But there is also the kind of downside of that, not to be too much of a negative person, is that what we don't have within that funding envelope is any accounting for inflation or staff increments and things like that. And the reason that I sort of say that is because what we really want to do today is get everybody's input and engagement, but what we don't want to do is kind of to create this expectation that we sadly can't meet, that because we've got this extra 18 months of money, we can do lots and lots of new and exciting things. What we really need to do, we can still do exciting things, but what we really need to do is kind of use this planning opportunity to reset the dial, to think not just about what we do, but how we do it going forwards. And we'll look at both of those activities in the session today. So the first bit, what we do, we thought that rather than just kind of say, what do you guys want, and sort of build it from the ground up, we should build on what we've done internally and what we've also done externally at the previous ARCFEST. So for those of you who were at the previous ARCFEST, you know we did an activity around the business plan. Since then, internally, each kind of team, theme, area of work has sort of taken an initial first pass about thinking about what it is that they want to continue to do, what new things should they do, what things should we perhaps wind down that aren't working in light of COVID or other, other changes and challenges. And from that, there've been lots of things that have emerged, but two key sort of themes or areas have emerged that we really want to get your input on today. So the first is children and young people, and the second is dental public health. So for each of those areas, that's not to say that we will definitely do lots in that area, or that we won't do other things, but we thought if we keep it a little bit focused today, as an experiment, we can see how that goes. So for each of those topics, we've got flip chart paper, post-its, pens on your tables, and there should be a facilitator on each table as well. If you've been assigned to a table, can you make sure you're on that table for this session if you're not already, because then it'll probably run better. So for each of the topics, we want to ask you, what is already going on in this area? So what priorities, activities, pieces of work, areas of research are already happening that we can add value to and work with you on, rather than try and really reinvent the wheel? The second is, what questions can research or should research try and help us answer in this space? And the third is, what inequalities are you aware of, either from your personal or professional experience? So activities and priorities, questions and inequalities. So that's for children and young people. And then we'll move on to dental public health. And finally, because we didn't want it to be too restrictive, there's a sort of final 15-minute session for you to answer around those themes across any sort of area of health and social care that's most relevant to you. So Mark and others have suggested data, maybe something that we need to discuss, and of course the cost of living, but we'll leave that to the tables and to the different organisations and priorities that are on those tables. Okay. So,
thank you.
Clear?
Yeah, it's a couple of things. So I'm just going to add something to that. It's really important. This is an infrastructure, and it's about collaboration. So we're particularly interested in work that you're doing with others, or that you'd like to do with others. The ARC isn't about doing a bit of work for one organisation or one bit of an organisation. It's a collaborative. We need to maximise the opportunity we've got of working with people we might not normally get the opportunity to work with, and about comparing across different areas. So, yes, it's not to what you're interested in, but particularly interested in knowing what other people would like to do. So what will come out of this is that we will be asking, so someone said this in children, who else is interested in this? So we can start to compile small groups of people to take those ideas away between now and September, so that we can feed them into our proposal. So it's not just an individual's idea, it's a collective prioritisation process. And I'm going to come back to the debate. I've not forgotten you here, but I wanted to sort of people to know what we're doing next. There's one other area which Katie doesn't really know about, because we had our national meeting at the end of the week, and it became clear from the national meeting that there will be some expectation that we will also be thinking about how we as ARCs can address the Minister of Health and Social Care's areas of research interest that were published recently. And I'll just quickly go over those. So have these in your mind as well when you're thinking about what we want to do, because we would like to put some material about that into our proposal. So these are available on the web, these to find, but I've sort of been looking at them in some detail. So there are 3 areas of research interest. Early action to prevent poor health outcomes. Sakti, music to your ears. Particularly thinking about obesity, type 2 diabetes, heart disease, mental health, children's mental health, multimorbidity. These were things that came out from their priorities, which is good, because that's quite a lot of what we're doing in the ARC already. Number 2 is reduction of compound pressures on the NHS and social care. And the compound pressures are things like pandemics, big things that happened that put stress on the service, such as an ageing population, unplanned care, so avoidable admissions. So they're thinking about how could we improve outcomes, reduce avoidable admissions, how could we be more resilient and more efficient, and could we use innovation to help us do that? They talk about smart discharge quite a lot, so how can we discharge people more quickly and in a way that that discharge will work and be successful and not fail? And thinking about how we can prepare for any new infectious disease outbreaks, pandemics, epidemics, etc. And the third area of research interest is shaping and supporting this health and social care workforce of the future. So what can we be doing about education, about training, about the culture, about supporting people to move, the way that they work, to think about new ways of working. And then there are some cross-cutting ones. Thankfully, number one of that is health inequalities. Otherwise, we'd have to go back to the drawing board, but that's still very much in there. How do we promote economic growth? Well, you would expect a government to say that, wouldn't you? And how can we adopt things at pace and scale? This phrase is still very much around. So it's about implementing the research to target the change that is needed. And there are some cross-cutting methodologies they want us to think about. Systems thinking. Great integrated care systems, but that's very much at the heart of this. We need to think as a system, not as little bits within a system. We need to think about data science and how we make use of big data, which is great because we've got a Health and Hair Informatics team. We've got Ben Barr and the work that he's been doing in the PLDR and all of the work that we do in the ARC and big data. We need to think about the economics of health and social care. They're very keen that we boost the influence of behavioural science and anthropology and innovation, and that things are acceptable, flexible, feasible, scalable, and work, and how we can use behavioural sciences to help us understand that. Very keen on real-world evidence and implementation science and evidence synthesis. How can we rapidly appraise the evidence to influence policy? And then like the idea of realist reviews and complex systems. So those are some of the things that are on the government website about what they want to see us doing, and ARCs are very well placed to deliver that sort of work. We can't do everything, but of those, what are you doing now around health inequalities? What are you doing now about the workforce? We've got theme meetings this afternoon. We'll be discussing some of those things in our theme, so please do talk about those. So having sort of whetted the appetite, I hope, for the work we're about to do that Katie's pulled together, can I come back to the panel and ask you for any reflections and ideas you've got from what you've heard and this morning? And I'll keep an eye on the chat. Jane.
Yeah, I just thought as a follow-up of the priorities that Department of Health and Social Care have for us, you mentioned before about linking research much more to the, what did you call it, the resource allocation. Oh, sorry. Hopefully people heard that. The resource allocation.
Yeah.
And I wondered if you could say a little bit more about that.
Yeah, thank you, Mark, again. I wasn't aware of this, and you could almost think about this as if these are national government priorities, you would expect the local government, especially where the politics is aligned.
That's where the money will be.
Yeah. And some of these things aren't necessarily done just through the NHS research infrastructure. And especially things like systems thinking, data science, the economics of health, these are pretty much playing out on the local political decision-making forums. And that's what I meant in terms of there's so much knowledge and wisdom through the ARC and the research that you're all doing. I was just amazed how so closely linked these are to everyday challenges that we're all facing. But yet, just a quick show of hands even might answer this question. How many of you in the room are from local authorities? Not a single person in this room.
Well, there might be online, to be fair.
Okay, so how many of you in this room and online combined are from local authorities?
I'm a retired local authority.
Okay.
Ben is an honorary local authority person.
Okay. I'm not. I know,
but you're right.
Itself.
But this is the challenge. We have 10
Yeah.
local authority member
It
organisations.
really is a challenge, and somehow to
Getting
connect
them here.
somehow we need to be relevant. And I am pretty sure if the directors of social care are listening to this about dementia, frailty, all of this, they would really want to engage, but
Funny you should
somehow we need to.
Funny you should mention that, because the next bid I've got to do in the next 4 weeks is capacity building and social care research.
It's a catch-22 situation to address this, because we really need this piece of intelligence and
We
information.
do, and we need to integrate with those local authorities, because we will be able to support capacity building in those local authorities. Yes.
I'm a retired local authority person, but also I have a son with a severe learning disability and so on, and autism, etc. Thank you. When I first heard about ICSs, I thought, yes, at last, integrated health and social care. Wow, that is what we need. It's what people like my son need. It's what people with dementia need badly. Where is it? Where's the I in integrated social care? Is there ever going to be an I in ICS? Because I can't see it.
What I do see is the NHS integrating with itself, which also is important.
And that's exactly what I was saying as well, that even the ICS is set up, you know, they need to now let us see what they're going to offer, because this is important. I can't see it either. I can at the moment, because I'm a patient participation group. I'm a public member in different organizations. And I want, when they say ICS, I say, great, you know, social services and the have people working together. And then the patient to be at the center of the care. I think that's what we should be looking at. Patients to be at the center of the care. So when a patient goes to the hospital and is going to be discharged, there should be like a good communication strategy with the social services, with the public care, with everybody, to make sure this patient gets the need of the care that he needs, he or she needed as
Thank
well.
you. Sakti.
Just finishing off that point, really, this is staring at my eyes, and if I am the only person in the local authority full-time working there, people like us, we really value your voice and the research knowledge that's coming out of it. We need to somehow strategically connect this into the local decision-making beyond NHS decision-making.
So maybe Ben, if somebody can chuck a mic at Ben, because he's the theme lead for improving population health, where the local authorities largely sit, and maybe Paula, you can maybe talk about EPIC or Heather and how local authorities are working with you, but just to reassure Sakti that there is that voice.
I mean, we do have a lot of engagement from local authorities in each of the sort of research projects. But I guess one of the challenges, I guess, with engaging with local government has been the constraints on resources and capacity within local government. Yeah, it just means that people are incredibly busy and not able to necessarily attend all the meetings. But we do have a lot of engagement, but I think definitely across
But that's more with public health and social services, though, isn't it?
Yeah, and I mean, some of
the challenge for the integrated, and the challenge I'm hoping we can meet very rapidly, because we haven't got much time to put it together, is to make that offer to local authorities, and any links you've got to sort of social service leads, to get them to think about how they can work with ARC across that integrated care system, because we will be able to put together communities of practice, research champions, and some of those, small scale, but nevertheless. I can see Heather's got her hand up, and I know I'm eating into your time, Katie, but I think it might be provoking ideas to oh, I know, but I mean, as in, you were, obviously it's everybody's time, but.
So I was just going to say, with the Blackpool HDRC, that is kind of...
Do you want to explain what an HDRC is?
Health Determinist Research Collaboration. So that, I guess the key thing of that is building research capacity in the local authority, but that involves partnership working, because Blackpool hospitals are very heavily involved. And as well, one of the first research that's ongoing is the Born into Care project. So that's working across social services and thinking about kind of integrating data, and as well involving people with lived experience. So I think that is a good example of what we can do by linking different NIHR infrastructure.
So I'm
together.
quite optimistic we'll have at least 2 of those soon, because I know one of our bids, at least one of our bids has been invited to go forward to a full bid. And I did hear a rumour that they're now talking about having up to 50 of those across the country.
Brilliant.
Presumably there will be another call if they don't get them all this time. And there may be some that have made applications that they'll go back to and say, okay, can you do X and Y, and then come back to us. Yes.
The key thing for me is what you just said, Sal, is about making sure we're relevant. I've heard that term so many times in the last couple of weeks. We do try and engage with local authorities, but for lots of reasons we know. I mean, it started that you asked that question. We're quite well connected in EPIC, but people could not make the time. I think we've got a couple online, to be fair, but that's not enough. So the take-home thing for me, as we're going into the workshop now, is what you talked about, research priorities versus money. We need to be more cognizant of what you want to do, and hopefully we'll get some really interesting insight. Just reflecting on what we are going to do, I think identifying research topics is really important. The how is even more important for me, and we've given that half an hour versus an hour and a quarter. So I think reflections for me is that, and we've given some time now to it, it's the how you do it. You know, we talked about workforce, health education England, where are you? And they're not even a member. We know they're you know, they've got responsibility for training, etc. I think there's enough expertise in our North West Coast to be facilitating those networks and those connections. I would argue we don't need to make new ones. We've already got those groups that are there, and we need to offer it to ourselves to be more proactive in getting out there and making those.
I mean, don't get me wrong, it's not the problem of ARC on its own. It's a systemic problem. So equally the challenges are with local authorities as well as, you know, how question. So I'm not sort of aiming at ARC at all. It's just the nature of the problem. We need to name it, and at least we can start to unpick it.
So, don't disappear yet. Any final thoughts from yourself, Joe? Anything you want to add, and from Greg?
I thought Ben's talk was incredibly uplifting. Sometimes when you think about the challenges that our families face, it just seems overwhelming, and that change has got to happen at a national level for us to make the improvements that we saw in the talk that Ben gave. So I thought that was a really optimistic talk, and made me feel a little bit more positive about seeing change, and how people locally can hold the power to make those changes.
I was impressed with the breadth and depth of the work that was presented. I think it really highlighted what Mark was just saying then about work that occurs across the system as a whole. I think when you look within that document about maximising the benefit of research, there's a strong emphasis on, and I'd say this is more carrot than stick, on there's an expectation for collaboration across the system, and I think that's embedded deeply within that. And I think that's what those exemplars were showing some of that. I think one of the highlights for me was particularly looking at Ben's work, is that need for clean, clear, well-integrated data sets. And I think the systems that we've got, Lancashire, South Cumbria and Cheshire and Mersey, I think we're very fortunate with some of the data sets that we do have, and we really need to capitalise on some of those. I know there's moves as well towards making a Northwest secure data environment as well, so that's potentially in the pipeline as well. But yeah, I think it's a really nice exemplar of what can be done when that it's almost like water, isn't it? Having that clean, clear evidence from across the system, it's really vital.
Thank you very much. So, thank you very much, panel.
Thank you. Nice meeting you.